And welcome back. Well, with us once again, because he's been on with us, I think, a couple times, Dr. Arda Bakshande with Alignment Healthcare. We're talking about the Alignment Health Plan. And I'd also like to welcome for the first time on our show, Ellen Sloan. She is a case manager with Monarch Healthcare, and we certainly know about Monarch.
Thank you.
We were talking about just a minute ago, if you folks have been watching for a long time, we used to have Pat Huckabee coming on and having a show, and it's great that you're here.
Thank you.
Yeah, so welcome to both of you, and of course,
we're
looking back at the logo. It's your 25th anniversary.
It is.
So I'm going to ask Doctor, you first, and maybe you can kind of explain your partnership. What is the difference between Alignment Healthcare and the Alignment Health Plan and Monarch? I think people in general get confused. You know, you have all these different levels. You have your insurance, you have this plan and that plan.
Right.
And let's remind everyone, tomorrow starts the day.
That's right. Tomorrow's open enrollment.
Yes.
Tomorrow until December 7th.
Yeah.
That's right. So to explain a little bit about our partnership, so us Alignment Health Plan, we are the health plan, and we then delegate services down to our provider partners, like Monarch. And so our partnership with Monarch is really centered around communication. So we provide the benefits to the patients, but really the care in the doctors, hospital system, case management is all delegated down to Monarch.
Okay.
The difference really is the communication, where health plans traditionally aren't very good at communicating.
Right.
And I think you can attest to this.
Yes, I can.
Is that we communicate very well with our partners because we want our patients, and it's very near and dear to all of our hearts, that they're the ones that are taken care of, especially the senior population.
So would you be considered a Medicare Advantage program?
That's correct.
Okay, all right.
We are.
Yeah, and I think most people are familiar with that. So tell me what you offer from a clinical perspective.
So from a clinical perspective, we've built a very large analytics tool that helps us identify patients who are at risk of everything from missing their medications to potential progression of their disease, likelihood of hospitalization. And we share that with our provider partners like Monarch. I think Ellen can kind of talk about what Monarch does, because they have a very rich and robust system of doctors, case managers that then take the information to really encompass their care around and centered around the patient.
Right, yeah.
Yes.
So I've known Monarch over the years, obviously very well, with Pat and all. So I kind of know what you folks do, but I would like you to explain it to our viewers.
All right, so we are an IPA, so we have many doctors out there. We have over 2,000 doctors that we work with, and we work with many health plans for seniors, and we offer these great programs for our seniors. We try and meet the patient's needs. We offer case management, and that includes having a nurse and a coordinator assigned to you, and you can call them for any reason at all. You can, if you have a question about an authorization, if you have a health question, anything like that, you can reach out to them. You have a one person to call. You don't need to, try and find your way around the system. Over the past year, we started a great new program for our cancer patients. We found they were so needy, and we wanted to help them to get the right care right away. So it's called our Oncology Navigator program, and as soon as we find out they have the diagnosis, we're reaching out to them to try and help them navigate the system and get to the right places, get the right authorizations, and also educate them. Yeah. So, and support them. That's a big part of it. And we also have programs, disease management, if you have congestive heart failure, COPD, diabetes. We have a team of pharmacists who manage these programs, and will meet with you and discuss your health needs. They'll go over your medications. They'll collaborate with your doctors. So they're available to you also all the time. We have social workers. We have nurse practitioners that can come to your home. If you can't leave your home, we also work with a group called House Call Doctors, and they will actually come and deliver your care in the home. I'm actually the liaison to House Call Doctors, and we have about 500 patients on usually with them. Yeah. Because we have many seniors who just can't get out. Whether it be short-term or long-term, they can come to your home and be your PCP and order all the, put you in the right program. They can order your meds. They can, get your authorizations for you, anything you need. So we try and make it easy for our members to get, access to the care they need. And then we collaborate with the health plans. They will reach out to us, as he said, and we also reach out to them if we have questions about, any benefit or what we can do, just to, assist our members in any way we can.
Yeah, and a lot of what you were talking about, I remember back when Pat was on, and a lot of these programs were starting back then, the house calls and things like that.
Yeah, it's very important there's so many seniors out there that need a lot of help.
Right.
And we try and, get them community resources, Meals on Wheels, things like that. And just whatever, transportation, work with them on getting them rides. Getting them to their doctors is very important, and a lot of them can't get there.
Right.
So,
that's one of the reasons why we partnered with Lyft on our end, is so that patients, as part of their benefit, can actually call a Lyft driver to drive them to their physician's office or to pick up a medication, as long as it's related to a medical issue.
Yeah.
Which is great, because now we do need to really provide the service that our senior population needs, and not leave them at home. If they need care, we need to go to them, and we need to be able to help bring them to us.
Right. Yeah, and I think that's a fantastic service, and more people use Lyft and Uber and all kinds of things now, and so it makes things a lot easier and convenient. We mentioned tomorrow begins the open enrollment time, and this is the time to evaluate what you need, and I think this is where the confusion comes in for a lot of people. There's so many different options out there, and they have to weigh my medications, or maybe I'm healthy. Do I look for a plan that's better when it comes to this or that, or where the all the formularies are? I mean, it can be quite confusing, right?
It really can, and I'll tell you what I tell my parents. So both of my parents are Medicare beneficiaries.
Right.
I actually have my aunt and uncle who live in the community here, and my two grandmothers who are now, last year I was talking about them, they were 97, now one's 98, and the other one's about to be 98. Is that you have to really look at the benefits and what's right for you.
Right.
And every health plan has different set of benefits. And I think when you look at it and see what other seniors are saying, look at Plan Finder and see where all the Medicare Advantage plans rank, you learn that there are things that are really right for me, and plans that are right for me, and there's others that may not be.
Right.
And look at what you really get out of it. And in my opinion, is that you want somebody who's going to be there when you call, having access to a physician at all times, or a case manager. So having this partnership where you can call a care navigator any time of the day at Monarch, or be redirected to a physician at Alignment Healthcare 24 hours a day, who understands you, who knows you, because the information in your health records are there, is vitally important, because we're not going to be redundantly checking things that don't need to be checked if they were checked last week and it's unnecessary.
Yeah.
I want to allow our senior population, and we as a whole want to allow our senior population to age at home, age gracefully, with the benefits that they deserve. They've been paying into Medicare their entire lives. They deserve to have a health plan and an IPA truly taking care of their needs.
Yeah, that's very true. And if folks want to find out more information, they can, it's actually, if you want to look it up, it's Alignment Healthcare, and that'll take you to all the information there and figure out all the different, I imagine you have a couple different plans.
We do.
Yeah.
We have a number of different plans, again, which is right, for each person. We have some for the chronically ill, we have some who have a Medicaid benefit, and then for others that want other plans that have different prescription benefits, rides, and things like that. Yeah,
all different kinds of things that are available.
Yeah.
And the main thing is get information, figure out what you need, and there's other types of places you can go to kind of navigate all that, and you can kind of plug in your information and figure all that out. But that's really important. The numbers on the screen, of course, Alignment Healthcare. You can go online and find that very easily. And great to see someone from Monarch again.
Well, thank you. I'm glad to be here.
Yeah.
One thing I would like to say is that I want the members to realize that you can self-refer into any of these programs. You don't have to have a referral from your doctor into
Right.
one of our programs. You can call us and they'll, hook you up into the program. We'll get you started. It can come from a family member or whatever. We're there for you. So.
All right, very good. Great to see you both.
All right,
I
thank
know I'll
you.
see you
as well.
again.
Thanks for having
Yes.
us.
And
Yes.
if you again want more information, just look up Alignment Healthcare. You can find it there. We'll be right back.